Hello from wherever you're watching. Welcome to some more healthy news. Today we're going through an article that was released last week on blood pressure and how it actually reduced following chiropractic care. We'll go through the article and explain a little bit about why this can possibly happen using chiropractic care to help such physiological problems such as high blood pressure, etc. We'll go straight to the article. It's titled Reduction in Blood Pressure Following Chiropractic Care in a 52-year-old Female. This was a case study and a review of literature. What a fantastic result for this lady. Let's call her a young lady, 52 years old, decreasing blood pressure. So we're just going to go through the mechanisms of how that comes about. One second. The PowerPoint is working once again. Let's get it happening. So this study was published in the Annals of Vertebral Subluxation Research. It was published in March, just gone. We're now sitting in the start of April 2022. And the authors are Martin and Roach. And quite interestingly, research has shown not only that the developing brain relies on normal spinal structural integrity, balance, and joint movement, but that complex neurochemical communication and pathways involved in helping people adapt to their environment are tied into spinal, biomechanical, and their related neurological pathways. So a lot of wording there, but if we look at the words that are being used, once again, we look at, once again, structural integrity, balance. That's what it's all about getting the nervous system in the chiropractic balance and making sure that the messages are getting to where they need to get to so that the body can do what it needs to get to. So quite extraordinary. And as we continue to go, it makes perfect sense when you think about it. The brain constantly needs and wants to know more where our body is in space and what is going on relative to all functions of the body. If there is obstruction to the neurological communication between the spine and the brain, all sorts of malfunctions can occur, and this can lead to symptoms such as blood pressure disorders. This was stated by Dr. McCoy from the Journal of the Vertebral Subluxation Research. So quite interesting. I'm just going to stop share again and just go through mechanisms there if we can. So we want to understand that this patient was a 52-year-old female. She presented to the chiropractic clinic with chief complaint of high blood pressure. She had initial blood pressure readings of 185/90. What was done is she was placed in a care plan of one adjustment a week for 12 weeks. So a 3-month time span. So over the 12-week period, the patient was seen 12 times and received 12 diversified full-spine chiropractic adjustments. Objectively, the patient experienced a decrease in her blood pressure over the 12 weeks she was under care. The magnitudes following chiropractic care of her blood pressure improved dramatically by 20 points by the second visit. By her 9th visit, she was no longer high. So quite extraordinary. We'll go to a little bit more details through the article. If I can bring that up again. So there are very important functional relationships between the spine and the brain, and if disturbed, can result in a host of problems with how the body functions, remarked McCoy. He added, there is abnormal position of movement of the spinal vertebra that can lead to nerve obstruction. It is this obstruction called vertebral subluxation, if chiropractic is correct. So in examining this patient on presentation to the chiropractor's office, structural shifts in the neck and mid-back were found. She also had decreased range of motion, tenderness and muscle spasms. These structural shifts can lead to obstruction of the nerve, and it is this obstruction called vertebral subluxations, what chiropractors are always looking for. So there we have a nice article again. I'll put the link in the description down below for if you want to go to the complete article itself and read it in its entirety. So one of the things that is interesting with regards to why such a physiological change would happen with regards to chiropractic care and blood pressure, if we have to think about it a little bit, one of the things that really affects blood pressure a lot are hormone levels in the body, such as cortisol, adrenaline levels, etc. So if we look at a lifestyle of a person who has high blood pressure, running at 100 miles an hour pretty much, not getting enough rest, high cortisol levels, high adrenaline levels, really not good balance with regards to how the systems should be working. So that tendency to have overloaded systems or systems that are ramped up too much or too overactive. So let's just imagine the nervous system is overactive, and if that's supplying organ systems, glands, etc., which are releasing all these hormones, which do affect blood pressure. And not only that, nervous system supplies everything, including heart and circulation and everything like that. The nervous system is overactive and not working well. How can we expect that things like blood pressure, etc., are going to be in check, are going to be in order? So these are the processes that chiropractors, we look at, we put our thinking cap on and we look at to make sure, okay, what are these processes? How are they not working like they are intended to work? How are they not working naturally? How are they working incorrectly? So then there's an option that a patient has. They can have, for example, high blood pressure, and they can say, okay, my blood pressure is high. I can take a medication for it, but there also may be other methods that can be used to lower blood pressure on a more natural basis. So these are things that we can actually think about moving forward with regards to conditions such as this. But definitely so. It needs more research. There are many cases who do fall under this category. Many physiological conditions have been helped with chiropractic care. I suppose it is just a matter of if anyone out there has any physiological issues such as this, it's a matter of just getting checked, seeing where the chiropractic can actually help. But it's articles like this to make it a bit more of an understanding of how amazing the body works and how complicated the body is. And sometimes it's not just as easy as saying, okay, we have this problem, let's just take this medication for it, or we have this problem, let's just do this operation, because that can lead to other things. It can mask things, it can lead to other side effects or other causes or problems with other things that need to be tended to at that point. So always the best way in health is to try and keep it as natural as possible. So there you have it. Any questions, just contact me personally. You can do that via email or by the phone to call our practice. Always here to help you with any questions that you have. Until we speak or until we meet, look after your health, because no one else will, and it is hugely important. Bye for now.